Well, synergy of different perspectives is a very rich source of innovation. Recently, the National Cancer Foundation awarded Dr. Wang and Professor Chen Zhu for a very important fact. They realized in the treatment of acute leukemia, a special form APL, an improvement in the 5-year disease survival rate of 25 up to 95%. And this is so remarkable that this will be the standard of care for this type of treatment worldwide. They realized this by integration of Chinese and Western medicine. And by doing so, they realized to have a very fatal disease changed into a very highly curable disease. And I think this is great news for all patients in the world and for healthcare in general. This example shows how Chinese medicine and Western biomedical sciences meet each other, and especially how they can complement each other. This will save many lives today, but especially also for the future generations. This is exactly the reason why we have founded the Sino-Dutch Centre for Preventive and Personalized Medicine. I believe that the Chinese way of thinking can contribute a lot to the system diagnosis, and by doing so it will help to improve therapeutic interventions, and this will contribute a lot to the healthcare system of the future.
As an overseas Chinese scholar, I have always treasured my root of culture and philosophy. However, scientific acceptance is one of the keys for globalization of Chinese medicine. After 15 years working experience in plant biotechnology at TNO, I have met Professor Jan van Greef in 2000. To my happy surprise that I learned Jan van Greef is open to Chinese medicine. From that time on, we have worked and discussed jointly for bridging Western Chinese medicine by systems biology. A joint research center with Chinese and Dutch scientists working together will be the ideal form for cooperation to build up a bridge from both sides. I was directly enthusiastic about the idea that we could use the modern Western technology for validation of traditional method used by Chinese doctor. I saw immediately the combination of both will bring new knowledge that will be understanding of the healthcare and prevention of disease. This will be the new dimension for global healthcare and will help further for globalization of Chinese medicine. Being a scientific member of Chinese Herbal Medicine Working Party at EDQM, European Pharmacopoeia, I realized and strongly support that Chinese herbal medicine should be very well regulated. Recently, SU Biomedicine, a spin-off company of TNO, has successful informal registration of the first traditional Chinese medicine in Europe from China. This is the first milestone for official recognition of Chinese medicine in Europe. I'm happy with our Chinese partner that they are able to produce this medicine under EU GMP with the European Pharmacopoeia standard.
The Dutch-Chinese herbalist Jan Vroen joined us from the beginning. His deep knowledge in both Chinese medicine and Western medicine, based on his personal training and experience, is really the bridge between the two worlds. He works as a Chinese medical doctor in a general healthcare center in Utrecht, and from the beginning he has been a member of the scientific committee of the Sino-Dutch Centre for Preventive and Personalized Medicine.
Chinese doctors don't know anything about the body-mind dilemma. This is because they see the body as a self-organizing dynamic system in which body and mind are mutually created. The personal approach of Chinese medicine is for me very satisfying. This unique approach of every person gives a unique picture of the self-organizing system of every individual. This is where it makes contact with modern theories like systems biology, and where metabolomics can help us understand Chinese medicine, but also find new ways in looking at our body and biological systems.
That is why we are so proud of the Sino-Dutch project performed in the Netherlands by Chinese students. In this way, they can validate the traditional method originated from their own culture. Within our Sino-Dutch Centre, recently, 2 students have obtained their PhD degree. Their work contributes to scientific evidence for Chinese diagnosis of pre-diabetes disease and rheumatoid arthritis disease. This knowledge will contribute to improvement of the treatment for these 2 diseases in Western medicine practice. This has strong implications for not only medicine, but also nutrition and lifestyle-related optimization. This has become research focus in our center.
In ancient China, Chinese medicine was developed for health promotion, not for curing diseases. This is why Chinese people still go to see their doctor to find out if they're still healthy and what to do with food or lifestyle advices. So if someone gets an illness, this means that the doctor hasn't paid attention very well.
Obviously, Western medicine has achieved enormous results in acute cases. However, in the case of chronic diseases and in prevention, I believe that we can learn a lot from the Chinese way of thinking. I believe that 1 + 1 can become 3.